Hi, I'm Harry Robinson. I'm the National Program Manager for Veterans Health Administration SimLearn. That's Simulation Learning, Education, and Research Network headquartered in Orlando, Florida. And our team is going to present a technical presentation on our capstone project for the Veterans Health Association Virtual Medical Center. As we get started, it's important to talk about the mission and vision of SimLearn. I'm not going to read these statements to you, but there are a couple of key things as you look through these slides. One, and most importantly, it's promoting excellence in healthcare. This is how we do a better job increasing the workforce skills and clinical expertise of the over 200,000 healthcare providers within VHA. Additionally, as the cause and effect there, what we're looking to do is improve patient outcomes through the use of simulation-based training. So why a virtual medical center, or VMC? We want to provide an environment, a medical center, hospital environment that is one that our patients are familiar with and therefore requires little adjustment as they navigate through this as an avatar in a virtual world. It also enables us to take a geographically separated staff and patients, with the VA having over 152 medical centers across the U.S., Philippines, and Puerto Rico, and our patients throughout the country in a virtual world can interact in what's a familiar and appealing environment. The meeting opportunities will be able to supplement constrained travel, CME, and conference budgets. Additionally, interactive content can be provided in a variety of ways. Avatars interacting, looking at WAV files full of briefings, whether it's just reading textual information. It will enable the user to tailor the means of which they acquire the information to what works best for them. It also allows us to use new generation of technology that meets the growing demands of our current veterans. 21st century learning environment, it provides an unprecedented modern approach to both patient and provider education, as well as supporting collaboration in an environment that feels like a hospital.
I'm Bill Gaud, a curriculum developer at the SimLearn facility in Orlando, Florida. What does the Virtual Medical Center provide? Well, it provides a VHA national curriculum that's been vetted by subject matter experts who are familiar with that specific clinical area. It also provides delivery in a familiar and appealing setting that learners will find easy to navigate. Movement of the keys, the teleportation, and the application of the VA apps and sites throughout the environment are standard. The Virtual Medical Center Advisor provides subject matter expertise of validated medical information to common questions posed by our patients. The virtual clinics will be briefed later, as well as patient collaboration, patient education tools, research, virtual classrooms, and other settings provided for veterans, providers, and staff of VHA facilities. Overall, the environment allows for the interaction between patients and providers, as well as patients to patients and providers to providers. In the middle of this particular graphic, we have an actual image of the new Orlando Medical Center that we're building in Orlando, Florida. Up to the top of the graphic, we will hit the consultation functions. The consultations are provided between the veteran with the live provider, as well as the veteran to a virtual medical advisor, which is pre-populated with a series of questions and answers. The left-hand side is the research area for patients. Patients come in and do research on various areas of specific clinical topics such as diabetes or other topics that they may have an interest in. In the provider's resources area, the healthcare provider will be able to go into the cyber library and review various journal articles and research materials that may be of interest. Also, there's a conference room area provided so that providers can collaborate and meet on various clinical topics. A special feature of the provider resources area is the serious medical gaming area. And so what will happen here is that providers will be able to go into this particular area and participate in serious games where they can practice simulation-based modality for training various clinical topics. The bottom area of the graphic details the training area. These virtual training rooms will be available for providers to go in and conduct as well as to participate in online training. And in addition to that, veterans can also attend virtual training sessions on various clinical topics. In the bottom right-hand corner, we have 29 fully functional clinics when the virtual medical center is operational. Initially, it will start out with 2. But these clinics will be very much like a real clinic in a hospital. We'll have a diabetes clinic, a GI clinic, as well as other clinics that the veteran and providers can go into. In the upper right-hand corner, we have the collaboration area. It is possible for veterans to collaborate with one another, as well as for veterans to collaborate with their providers. In another option, providers can collaborate with providers. When the veteran or the healthcare providers enters into the virtual medical center, they will enter into this lobby. As you can very much see, is much like the lobby of any new modern hospital. They will be able to walk up to an information desk and request information from an avatar, who will then direct them to various areas of the virtual medical center. So at this time, let's go ahead and move into each of the clinical areas.
My name is Haru Okuda. I am the National Medical Director for SimLearn, which is VA's National Simulation Center. In this slide, we have an auditorium where clinical providers are able to meet to attend national level training sessions. The current challenges within the VA, travel funding is limited, and many of the providers are unable to get out of their clinical obligations to attend such conferences. These training conferences are required for their continuing education to maintain their practice. And what this allows is for these providers to attend without travel, share best practices, and collaborate with one another, and obtain continuing education credits. In this slide, we have an example of a virtual learning environment. This is an environment where staff can maintain their required competencies. One of the current challenges, many of these required competencies are done in small units. To get the staff together from their separate tours to do a training can often be challenging. There are also limited number of faculty to facilitate these training programs. The benefit of doing this in a virtual environment, staff from off tours or separate facilities can come together with a faculty member to participate in this program. In this slide, we see 2 images, one in the virtual library and 2 in a virtual training environment for patient education. One of the major challenges for patients is access to relevant information. In this virtual medical center, patients can come and search a whole database of both documents and video content for their exact questions and needs. Here we have a picture of a virtual medical advisor. Often patients come to see their providers to ask straightforward questions, often having to wait for hours to be seen. The virtual medical advisors allow the patients to come and ask questions in a virtual environment to answer their needs without having to wait to be seen. This is an example of 2 rooms where e-consultation can occur. E-consults allow for patients to access real providers to answer any of the questions that they need. Often, some of the questions or therapy can be done in a virtual environment without having to go to the medical facility.
I am Scott Mitchell, the simulation specialist for SimLearn. This slide shows a picture of a training classroom like you would find in all VA medical centers. This classroom has many uses. Providers can collaborate virtually with other providers using media they can project onto the classroom training screen and the computers for discussion, consultation, and teaching purposes. Staff can participate in meetings and patients can attend group appointments and training events. This slide shows a courtyard with an amphitheater that serves as a gathering space for providers, patients, and staff to socially interact in a real-time public setting. A patient can interact with other patients or providers in an appealing outdoor setting similar to what is possible on Second Life. This concludes our presentation on the Virtual Medical Center that we are developing and hope to have operational by next year. For any questions, please feel free to contact us here at SimLearn.